My name's Jo Jordan, and I've been asked by the Physiotherapy Research Society to record this lecture on understanding systematic reviews. The aim of this lecture is to give you an understanding of what a systematic review is, where to find them, and how to judge how reliable a systematic review might be. I'd also like to help you to get started with your own systematic review. You'll see many different terms for systematic reviews in the literature. These are just a few of them. They range from literature or narrative reviews, which are the broadest, to more rigorous systematic reviews and methods that are used within them. One thing to note here is that meta-analysis. So it's sometimes used wrongly to describe a systematic review, when it's really just one element of a systematic review. It's used to combine, statistically, to combine the results of individual studies. But it does not say and does not describe how those studies were selected for inclusion. So the official definition of a systematic review is a summary of medical or health literature using explicit methods to systematically search, critically appraise and synthesize available evidence on a specific issue. Like with any type of research, the robustness of systematic reviews can vary across a spectrum like this one. Not all systematic reviews are reliable and trustworthy. Generally, these are the important elements of systematic reviews, starting with a predefined research question and also inclusion and exclusion criteria. We then do a systematic search, which is very comprehensive and structured, usually of several different databases. After these searches are combined, then we usually have several rounds of screening of titles and abstracts of articles before we get to the full text of the papers. This, along with the quality assessment and data extraction, is often done by more than one reviewer, as each stage can be quite a subjective process. You would also expect the review authors to say how any disagreements between reviewers are going to be resolved during that process. So data is extracted into forms and spreadsheets, and that will then is used in the synthesis and also in the writing up stages of the review. In a good published review, you should be able to follow and understand and also replicate how the reviewers got from their individual studies to their conclusion. Here I've just put a few sources for easily to find systematic reviews. It might be helpful to go through a few reviews with the critical appraisal tools I'm going to describe later and to just get a feel for what a systematic review is. When you are critically appraising or assessing quality of a study or a review, it is important to bear in mind that it's not the study, it is the study or the review itself that's being judged, and not just the published report of it. The critical appraisal tool is there to prompt you and to ask the right questions so that you can judge. However, what is in the published report of the review can affect how easily it is to judge it. There are guidelines for reporting most types of research, including this one for PRISMA for systematic reviews. And most journal editors now require authors to follow this, although it will depend on how rigorous the peer reviewers are as well. So there are reporting guidelines for all types of studies, and these are available on this Equator website. So as you can see, there's a consort statement for RCTs as well on there. So these are a few of the many critical appraisal tools that are available for systematic reviews. So the CASP checklist and the Joanna Briggs Institute also have tools for other types of reviews, other types of studies, but we're going to use CASP in this presentation, which is also a very useful tool for when you're assessing reviews for your own clinical practice. So the first question on CASP, did the review address a clearly focused question? We generally use a PICO type formats for research questions. So there's different formats for different types of questions, but PICO can be adapted to most of them. P is the population, I is the intervention, or you could also be whatever factor that you're interested in. And C is usually a comparison, and O is the outcomes of interest. So in this example I've given here, P is people with chronic low back pain. The I bit is the acupuncture. C is the sham intervention, no treatment or usual care. And there is no outcome in this specific question, but you could have an outcome that's either pain or function or some other particular outcome of interest. It's quite a balance with setting a systematic review question. They need to be quite focused to be able to answer them, but not too much that no relevant information is found. So CASP question 2. It's also important that the review includes the best type of studies to answer the question that they're looking at. So for randomized controlled trials, for example, the best way to evaluate whether an intervention works for a particular population is by using a randomized controlled trial. But there are also other types of study that are better for certain types of question. So we're looking at the highest level of evidence for different types of research question. So as well as for RCTs for treatment questions, we've got cohort studies that follow a large number of people over a long period, which are quite good for assessing adverse events and also prognosis questions. And to find how acceptable treatments are to patients, and if there were any barriers to things such as services, we might use qualitative research questions and qualitative studies, which would find these answers, this type of answer better. So the third question on CASP, do you think the important relevant studies were included? So a good systematic review relies on a thorough, structured, systematic search for studies. If the search wasn't reliable, then the rest of the review isn't going to be very helpful. The review report needs to say the database is searched and also other methods used to back these up, such as looking through references of the included studies and asking experts in the subject area. We can also look at unpublished as well as published studies because of publication bias towards positive larger studies. And also the same applies for non-English language studies, but these aren't so critical and many reviews don't include them. So just wanted to give you some tips for assessing and judging good search strategies. So it's quite a complex process. So the review will definitely need to say the databases and also the platform that the databases were searched on. So for example, Medline is available on several different platforms such as Ovid, EBSCO, ProQuest, and also as PubMed, but only one version of this is going to be needed for a particular review. So it's not enough just to say that you're searching EBSCO, you would need to say which individual databases you were searching on the EBSCO platform. You need to know when each database was searched so that you can tell how up to date the review is. It often takes quite a while to get reviews written up and published, so the search date is quite important. Other thing to look out for is a full search strategy for at least one of the databases that was searched. So it's not enough just to give a few keywords that were used in the text. So the search strategy is a numbered list of searches that was conducted on the database as they were entered into the database. There should be clear sections for each of the important parts of the review question. So there may not be one for each part of the PICO, for example, but at least the population and maybe the intervention should be used as a separate section within the search. So text word searches are needed for key terms and then all the synonyms that can be identified. And those are done, text word searches are done usually within the title and abstract fields of the database. And also they need to use the index terms and subject headings that are contained within the database as well. So for example, Medline has MESH as its system thesaurus of index terms, but each database is different. So each needs to be searched separately. So all the search terms need to be combined in an appropriate way, so using Boolean operators. And this would be or for all the synonyms and similar terms, and then and at the end to combine the sections of the search together. This is an example of a search strategy in Medline. It's a very complex search strategy. And it's for back pain and acupuncture RCTs, the same as the example question earlier. So I'm not going to say too much about this, apart from pointing out that there are different sections, different colours that apply for different parts of the question that were in the review. And then you can see the last line, line 35, is where these lines were combined, or these sections were combined together right at the end. So CASP question 4 is referring to the quality assessment within the systematic review. So assessing quality in a systematic review, like we're doing here with this, with a systematic review, looking at a systematic review, is a very subjective process, as you can probably imagine. But it's important that more rigorous studies can be given more value in a systematic review. The systematic reviews needs to describe how the quality of the included studies was assessed in the method section, including if a published validated tool such as the Cochrane Risk of Bias tool was used, or what criteria the studies were judged on, so that we can also know and judge ourselves. We also need to know how many reviewers and how disagreements were resolved. Scores for quality assessment have a place, especially within a meta-analysis. But in the text, just saying a study scored 5 out of 7 isn't helpful to the reader. It's better to compare studies based on specific items or maybe domains, depending on the tool. Also, some items of a tool, such as maybe participant blinding in an RCT, might not be as important an issue, particularly if none of the RCTs could feasibly do blinding. So that item isn't as important and could be possibly taken out of the tool. It's very important that quality of studies is incorporated in some way into the review, analysis or synthesis. So quite often that's neglected. The analysis or synthesis in a systematic review can be narrative or quantitative. So in quantitative would be a meta-analysis, or maybe a combination of both. So some studies may not be able to be included in the meta-analysis, but should still be included in some way. So maybe a combination of a narrative and the meta-analysis might be included. So they can also, narrative and meta-analysis might answer different aspects of the research question. So a meta-analysis, as I've already mentioned, is the statistical technique used to combine results of studies. So larger studies are generally given more weight, or weights could also be based on other things such as the study quality. Results of meta-analysis are usually presented in a forest plot. So this is a forest plot for a review of the effectiveness of injections versus placebo for shoulder pain. It's looking at a success rate in the short term and comparing the differences in risk across the studies. The studies are listed down the left-hand side with the success rate for the injection arm and the placebo arm across it. The estimated average differences in risk between the two arms is on the right-hand side for each study, and this is represented by the line with the blue square in its centre, which is the average, the estimate. So the size of the blue square represents the weight of that study in the meta-analysis. So the larger the study, the larger the weight and the larger the square. So also the horizontal line through each square, that's the 95% confidence interval. So for each one, we are 95% sure the estimated risk difference is along that line, and on average it will be where the square is. The vertical line at 0 is the line of no difference between the intervention and the placebo. And if the confidence interval crosses the line of no difference, and we say the difference is not statistically significant, although if it doesn't cross, it's statistically significant, although it may not still be a clinically significant difference. The black diamond at the bottom of the diagram is the combined risk difference from all the studies calculated from the meta-analysis. Risk difference in this case, but we might also have odds ratios, or relative risks might be represented instead of the risk difference, and in which case the line of no difference is at 1 for an odds ratio or relative risk. The width of the diamond, so the diamond is the combined risk difference in this case, and the width of the diamond represents the confidence interval of that from the meta-analysis. So a narrative synthesis is quite difficult to describe, but it is just important to describe how clearly in a way as possible how a narrative synthesis was carried out or is going to be carried out in the protocol. So a narrative will tell a story that ties the results of the individual studies to the conclusions in the systematic review. So you can use quantitative and qualitative methods. They're quite often used. combining the results in different ways. So qualitative research methods might be a thematic analysis or so on. So there's also different techniques in qualitative research systematic reviews, such as meta-ethnography is one method that's used, but these need to be described in the method section. So generally, there's differences and similarities are explored to explain differences between the study results. And summaries are needed to provide are needed for the outcomes that were set out at the beginning of the review. Also, the quality of the studies needs to be considered alongside the results and incorporated in a meaningful way. And there are a variety of different tools that can be used to present the information from the individual studies, and usually quite pictorial, or there's often tables are very useful, and also forest plots are quite useful to present the numerical data, but without the meta-analysis. There's lots of frameworks and guidelines available, but the two main ones are the narrative synthesis framework by Poppe et al. And also the synthesis without meta-analysis, which is relatively new but has been taken up by the Cochrane collaboration. So the other thing about the synthesis, particularly a meta-analysis, is considering whether the results have considering whether the studies are similar enough. Is it reasonable to have combined the results? So there's statistical heterogeneity, as we call it, as well as there's differences in study characteristics, such as participants, interventions, and settings. So these need to be considered to see whether it's reasonable to combine the results. And then there does actually need to be some form of synthesis, whether this is a meta-analysis or a narrative synthesis. Is not enough just to describe the results of individual studies, which can be quite tempting when you've only got a few, but there needs to be some attempt to combine these together in some way. So we need to consider how meaningful it is to combine the results, combine the studies. As we can see, it's not always just because there's numbers, you can't always combine them, but also you need to, just because something looks similar in some ways, is it similar enough to give you useful information about the answer of the review. So there are different ways to assess the heterogeneity. Firstly, is just looking at the forest plot and the results of the studies to see if they look similar enough. If there's lots of toing and froing of results and confidence intervals. Then there are also statistical tests. So the Q test suggests if there's heterogeneity is present or not, but it's not always helpful because there's a large risk of error. The I-squared is a bit more helpful because it describes the proportion of the variation that there is, but it can still be affected by things like having small studies, so it has to make sense as well. If a review has heterogeneity, or a large percentage of I-squared, then it should be dealt with in some way. So they need to have addressed, the authors of the review need to have addressed this in some way. So there's different ways to do a meta-analysis. They could use what's known as a random effects model instead of a fixed effect model. This just takes into account the variation to a certain amount. So you can't do it for large I-squareds, but if a I-squared it's still reasonable, then they could use a random effects model instead. It just gives more takes account of that variation a bit more. It's more conservative in the estimates. It may be possible also to identify certain subgroups, different studies that have different characteristics, maybe within the population or the setting or the interventions. And you can either analyse these separately as separate subgroups or see what effect they have by taking them out and using a sensitivity analysis. Or again, there's the option always not to do a meta-analysis and to rely on the narrative synthesis, which is a valid option as well. So questions 6 and 7 are about the results and how precise they are. Going back to the previous forest plot that we had, here we can see the combined risk difference was 0.31 with 95% confidence intervals of 0.24 to 0.38. So this can be interpreted as, so on average, people who had injections had 31% more chance of success than those having placebo. However, even though this was statistically significant, there was significant heterogeneity, which you can see by the I-squared of 70.8% at the bottom there on next to the black arrow. So, which would mean considerable variation between the studies, which would need to be investigated to tell if certain patients or certain people having certain interventions respond better than others. The next section of CASP is about generalizability. So, and how the review and the results might be relevant to you and either your research or your clinical practice. So, are the patients and the setting the same or similar? Were the outcomes the ones that you're interested in? So, for example, was patient satisfaction considered, or was it just clinical outcomes? What's important for you? Also, for question 10, you need to weigh up the benefits and the harms. So, were the benefits worth the risks if the harms were or risks were described, which they're not always, and maybe also if it was in the review, what are the costs of treatment or even a service? So was it worth it according to this review, and can we rely on the results of this review? So yes, based on all the answers to all the questions in the CASP tool, do you trust the results of this particular review? Was there anything in the methods that gave you cause for concern? And also, does it actually answer your clinical or your research question? So finally, I just wanted to give you a few tips on how to get started with your own systematic review. So the first thing to consider is to find your question. Make it focused as possible, or if you can't, if there's lots of things that are making it quite broad, is it possible to split it into separate reviews? Stick to your question and always refer back to it through the process of doing the systematic review. If you always come back to it, then it'll always be in the mind. It's easy to get sidetracked onto other aspects that you find in the research. So make sure you write a full protocol at the beginning of the process that describes all your methods, and it will guide you through the process. And it's also possible to register your systematic review on Prospero, which is quite a good idea. Also, you can look on there to see what other reviews might be being conducted, and you may find one that's very similar to the one you're doing. It's definitely better to have one or two people to help, and it's also more fun. If you know someone else who's doing a review, either a colleague or a friend or someone on a same course as you, then it might be possible to buddy up, and then you can help each other and also get extra experience working on a different systematic review as well as your own. Absolutely, definitely get help with your search at the beginning of your search process. So once you've got your protocol and your research question, then consult a librarian or an information specialist who's experienced in doing systematic review searches, and also use some sort of reference management software such as RefWorks or EndNote or whatever's available to you. Yeah, even some of the free ones such as Mendeley can be quite helpful for managing your search results from all the different databases that you're going to be searching, because there is a big overlap, and it will help you with deduplicating your search results. There's also software available that can help with managing the screening parts of your systematic review and other bits as well, especially when you've got more than one reviewer. So Ryan is we've used quite often, and it's free to use. And can keep everything under control. I'm trying to manage all the different search results, and it keeps a record of how many were at each stage of your review, so that when you do your flow diagram, which you have to do as well, it will give you the numbers to go in your flow diagram. And the most important thing, I guess, is just to keep a record of everything you do at all the different stages of your systematic review. So reviews can take quite a while to do, and so by the time you finish or you're writing up, you don't always remember everything. So if you write it down, make a document it through the process, you won't have a mad panic at the end. And definitely lastly, one personal message to everybody is don't be daunted about the thought of doing a systematic review. They really aren't that scary. Once you've got your protocol, it's just about step-by-step process and following that through. I just wanted to leave you with a few resources that you can go and have a look at and refer to for further information. So thank you for listening.